both mentally and physically.
Something I'll never forget is seeing loved ones saying goodbye.
It was something we'd never ever dreamt of. Hello, my name's David Parry, Regional Care Director with responsibility for a group of residential care and nursing homes. The immediate reaction to COVID and pre-lockdown was one of confusion because we didn't know whether it was going to be a general infection that we're used to in care homes that happen every year, whether it was a severe type of flu, or whether it was going to pass us by like the other SARS infections did and MERS. So we were very unclear and didn't overreact at first because we didn't know what we were facing. It's only as time went on that we realised we were dealing with something much more severe. As the stories came in from the first waves, mainly in Europe, in Italy, where care homes and hospitals were overwhelmed with people with severe COVID-19 symptoms and illnesses, and people were dying in those settings. And when people started dying in care homes, not just residents importantly, but staff as well, it really started to bring it much closer to home. I think it had a tremendous impact on me personally, not just in terms of anxiety for what was happening, fatigue, but the fact that we could go almost from a Christmas party in December 2019 to a lockdown and a serious outbreak of a virus by March 2020 was something we'd never ever dreamt of.
Lisa Stevens, a care home manager from Hertfordshire, explains how the pandemic changed the homes from being fun, happy and sociable to strict, isolating and upsetting.
At the beginning when the rules changed, we went from having families visiting us all the time to suddenly nothing, no doctors visiting. Our jobs changed drastically. We went from doing audits and inspections to suddenly nothing. When I thought this was very serious was the first lockdown, Easter weekend. We were completely shut down. There was no testing. We know what symptoms to look out for, but we didn't know how to deal with these symptoms. I'd be calling doctors, asking for advice. They'd tell me that there's no paramedics or doctors available or nurses. It was the first point where the severity and the seriousness really kind of was highlighted for me. I tested everybody in different ways. I certainly changed a lot as a person. Whenever I'd hear the word outbreak or COVID, it brings anxiety. I'm a lot more panicky. And when I think about how it made me feel, I'm very worried, cry a lot. We had PPE for all the staff and I was the first point of contact, so whenever there was an outbreak, we essentially went back to being carers. It took me back to my roots because I would be going from giving advice and managing to being on the floor doing a shift.
Every job in the care sector changed. It went from roles and duties they were used to sudden calls to help, extra requirements, and the need to be available at all times. David Parry discusses how he dealt with the severe changes.
The job changed dramatically because we were having to create specialists units for people admitted from hospital with COVID at a time when we were assured that it was safe to do so and there was unlikely to be spreads and outbreaks in care homes, even though we thought very differently. So it was one of having to reassure residents, staff, relatives and other visitors, and really changed from one of running a home from on a day-to-day basis with the usual problems.
Visiting in all the homes in the country stopped. The homes were essentially locked as only staff and health professionals could go in and out. This was to stop the spread as residents were deemed the most vulnerable group. Davis tells us how visiting worked.
We stopped visiting altogether in the first wave and opened it a little bit and then shut it down again. It became a real test of the resilience of staff and residents because there were times when people didn't see anybody for months on end, and there are times when people looking through the window couldn't understand why their daughter or son or family member couldn't come in to see them. So it had an impact that we were never thought we'd experience in in our lives in terms of saying, no, you can't visit. We weren't able to meet with relatives in the same way we used to do on a regular basis. We weren't able to give reassurance in the way we were able to, because face-to-face reassurance where you can see somebody's expression and response is much better than trying to do it on the telephone or even FaceTiming. So it did have an impact in terms of the way that people were able to cope with having a relative in a care home, let alone somebody with COVID.
It was not just the residents and the families that struggled to cope. The effect on staff is everlasting. Many required counselling from the things they saw and the things they experienced. Emma Smith from Hertfordshire tells us why so many people needed that help and support after COVID.
I think for all staff working in care homes, the changes were so dramatic that it was only afterwards that more and more staff have started to feel the impact of what they had to experience, particularly those homes that had large outbreaks of COVID in December 20 and early 21 when vaccines weren't readily available and residents were dying very, very quickly. And staff couldn't stop that or help that. I think that has affected a lot of staff because the whole home changed so quickly and the restrictions changed and our lives as care staff had to go on as normal while everybody else seemed to be having fun, spending time with their family, being at home, enjoying the sunshine. We had to carry on as normal, and sometimes it felt people didn't appreciate what care home staff had to go for because it's not quite as seen as out there as being a nurse or a doctor and working in a hospital. For some staff it was very, very scary and the things they experienced they won't ever want to experience again. So we have had to make sure that there's been extra counselling, staff have had to take time off, staff have given staff the opportunity to talk about it together and look back and reflect and share lessons learned, and while we hope this never happens again, I think we've taken a lot of lessons learned from it.
It has been revealed that 34.4% of all care home workers in care homes like this one left their jobs in 2020 and 2021. This highlights the effect the pandemic had on them. However, the pandemic also had an enormous impact on the residents. Many were left confused and distressed about the change.
Some older people were unable to understand what was happening and why their daughter was not in the room and why people were using face masks. So there was a whole new approach to the job that I did in terms of reassuring, educating, and we weren't sure at the time what the facts were.
Several families couldn't see loved ones throughout the pandemic, but even when things started to open back up and rules were lifted, care home residents still couldn't receive visitors. Care homes were and still are very strict about visiting. Chloe Moore from Bedfordshire is going to tell us about her experiences. Her grandmother was in a care home with dementia throughout the pandemic.
The demands from her illness were getting a little bit too much for us to handle, so she was forgetting things a lot more, not eating as much, and there needed to be more specialists around and care that we couldn't give to her. The last time I saw her was the day before she went into the home. It was her 80th birthday, so we all went round my auntie's and had a few drinks and things, and it was a send-off, I guess. So the visiting restrictions have varied, but they've always been more severe than what the law has actually allowed. So obviously in full lockdown we weren't allowed to see her, only my auntie, so her daughter, was allowed to see her through a window or something like that. Then as the rules relaxed, she was allowed one visitor, but they must have a test before they were allowed to come in. They always had to wear masks, which was quite scary for my granny because she couldn't really remember anyone anyway, and then to see only sort of the eyes of someone was quite scary for her and made her more reserved than she already is. Then it went up to 2 and then 3 visitors, but still with those needing a test and wearing masks all the time. And then as we went back into lockdown, the visiting then stopped again. Unfortunately, I haven't been able to see her, being away and at university, so that's been quite hard, because obviously being around a lot of different people, when I've then gone home, my parents and my auntie have been quite standoffish for me to go and visit her, just to make sure she's safe with everything going on at the minute. Hopefully I'll be able to see her soon, but with rules constantly changing, the COVID cases are increasing again. I am triple vaccinated, so it means I have a higher chance of getting to see her, but also living away at university is a barrier to seeing her as well.
Chloe's situation highlights how far care homes have come with visiting. Care homes are trying to get all lives back to how they were before COVID, although there has been obstacles. Some question if it is safe or even possible to get back to how things were before COVID.
It's been very difficult because there's the desire not to open up too soon and introduce the virus, especially as testing has stopped and free tests are not available. We all accept that we have to live with this virus. However, we also have some very vulnerable people in our care. We've opened up generally quite well, and we've not limited the times people can spend, but we have tried to be sensible about using our own testing processes, because we're able to still to get lateral flow tests. We're still nervous, we're still anxious, but we're trying to make things as normal as possible, and the usual events of day-to-day life in care homes are opening up again. There are activities and outings and entertainments and things that make life worthwhile, which we're not able to do during the lockdowns of 2020 and 2021.
Things are somewhat getting back to normal. We're allowed visitors in again, we've got music playing, we've got celebrations now, but it's still very different to what it was before. We've got a new normal. Everyone, all the staff still have to wear masks. When visitors come into the building, they have to wear masks. So it's very much a new normal.
The new normal is seen as a great success despite the differences. COVID had a big impact on everyone, and that will never be forgotten. But it was the care homes that were forgotten during this time. It's finally clear that what happened to them wasn't as simple as originally thought. But care homes are now in a position where they have strength and hope.